Well, you can take back control of your health with innovative, evidence-based, holistic treatments. You can do that all and more at ViveWell Health.
Yeah, that's right. They focus on identifying the causes of health concerns, not just medication symptoms, right? We're here with Dr. Ben. He's in studio today. We're really excited about what you do on a day-to-day basis and how you're helping our community. Dr. Ben, tell us more about what exactly it is you do.
Well, I started out with biochemistry, the study of metabolism, ended up going into osteopathic medical school, learned a lot about different ways to look at health, and had a career in emergency medicine. It was when I was doing my MBA and I had a public health paper looking at nutritional deficiencies, how people got sick with, lack of vitamin D, C, zinc, selenium. Turned out all that stuff is related to oxidative stress, how you have oxygen radicals and antioxidants, but that's intricately connected with inflammation and stuff like long COVID, chronic fatigue, fibromyalgia, but also blood pressure and obesity and diabetes, advanced aging. Getting old too fast from stress, right? And even cancer. The latest cancer research is all about metabolism and immunology right now.
And you just mentioned long COVID, right?
Yeah,
is that something you're seeing more of nowadays?
Tons of people are sick, after they just never seem to get better, and so we can help them.
Okay.
So you're trying to look at the actual root cause rather than just treat the symptoms.
That's right.
Yeah. So why is patient engagement so important for you?
So when you understand what's going on with you, you're more likely to do something about it. And so when providers actually share the decisions with the patients, they're not only more satisfied, but they actually have better outcomes.
And what is precision medicine? Can you break that down for me, for folks out there and myself who don't know much about what that means?
I'm glad you asked.
Yeah.
So the great thing about people is no two of us are the same. Right? We're all different.
Right.
And just like we have different fingerprints, you have a unique metabolism. And so whether that's genetics or lifestyle choices or nutrition or even environmental factors you can't control, all of that plays a role. And so we actually use sophisticated tests to figure out exactly what is going on and then to precisely support the component or the nutrient that needs help so we can get you feeling better.
And you'll help assess, you know what I mean? When people come in and see you, like you said, no one, two is the same.
That's right.
And you'll just help them out along the way.
Everybody has an individualized plan.
Got it.
What do most people come to see you for? Is it weight loss or something like that?
We have a lot of different services, but where we bring things together by looking at all these different components, weight loss is a great place to start. So whether it's looking at your thyroid or your hormones or digestive issues or food allergies, we can actually dial in so you get lasting effects. But we can use some of the cool new medications. You hear a lot about semaglutide or Wegovy or Ozempic. We use that too, but also, we prevent people from having the yo-yo effect of going off of medicine and just getting it all back.
And regenerative, I can't say that word, regenerative.
Regenerative medicine.
There he goes. It's very promising, right? But what about if someone out there, maybe one of our viewers, has joint pain? Would you be able to help with that?
All of this metabolic work is actually happening inside your joints too.
Okay.
So with the proper nutrition and even some fancy things like stem cells, peptides, platelet-rich plasma, we can put all of that inside the joint and actually help regrow so you get healthy and get active again.
What doesn't this guy do?
No, seriously.
Is my question for you. All right.
I might actually go.
Yeah, seriously. Hey, that's a good segment idea. We'll throw Chris out there. Go see Dr. Ben.
I actually have my own story of avoiding a spine surgery by having platelet-rich plasma in my spine, and so
PLP.
I've done all of these things myself. My family, my wife is feeling great. She's back in dress sizes that I bought her when we were dating.
Hey, there you have it.
Yeah.
Give Dr. Ben a call.
She must be really happy then.
Yeah.
She's got a lot of spark in her.